And with that, let's move on to our top focus. Another child has died in RML hospital of Farrukhabad. It's the same hospital, remember, which is in news for the death of 49 children in the month of August due to lack of oxygen. However, the latest casualty in this hospital is due to the alleged apathy by the hospital staff. As per the parents of the deceased kid, the top government hospital asked them for undue payment for the treatment of their ailing child. They also allege that the hospital kept them in the dark about the health problem the child was facing.
बच्चा मेरा ऊपर 3 मंजिल पे रेफर कर दिया, ठीक है। कुछ नहीं, ना डॉक्टर ने बताया ना इन्होंने बताया कि बच्चा की या नली मतलब खाने की रास्ता है कि नहीं, लेटरिन की रास्ता है कि नहीं। ये सेफई के लिए यहाँ थे, बच्चा को मेरे रेफर कर दिया। फिर इन्होंने के बल्ला खीन लेके जाओ, बल्ला खीन लेके गए। उनको क्या वाली थी 2000 रुपए फीस, उन्होंने तो फीस तो ले लेंगे प्राइवेट में। 2000 रुपए फीस उन्होंने ले ली। क्या बोले मालूम कि तुम बच्चा भाई साहब तुमको बताया नहीं सरकारी लोहिया में। हमने भाई साहब कुछ नहीं बताया कि बच्चा नहीं, जो 2-4 घंटा का, 1 दिन का, 2 दिन का समय इसका, तो जो खवा पी रहा है बस सही है, लेकिन कुछ फायदा नहीं। अब पैसा बर्बाद आपका होगा। बस हमारा बच्चा डॉक्टर की लापरवाही में खत्म हुआ और नर्स जो मैम अंदर बैठी हैं उनकी लापरवाही में बच्चा मारा गया है। बस
Well, in Farrukhabad, the doctors of RML hospital have gone on a strike against government action being taken against the CMO and the chief medical superintendent. Remember, an FIR was filed against these officers after reports of death of 49 children in the month of August alone. Now, this move after the city magistrate report confirmed the deaths being caused due to lack of oxygen. Doctors have demanded that the FIR against the CMO and the CMS should be expunged. In a shocking repeat of the Gorakhpur hospital tragedy between the 21st of July and the 20th of August, around 30 children died in the sick newly born care unit of Farrukhabad's Dr. Ram Manohar Lohia Hospital. Also, 19 babies died during or soon after their delivery. Amir joining us over the phone line. Amir, we do believe that more and more doctors of Farrukhabad are joining the protest. How big is this strike becoming, and to what extent have health and care services been affected in this district?
Well, the doctors did go on a flash strike immediately after the FIR was registered against the CMO and the chief medical superintendent there. But by late evening, when the government actually clarified out here in state capital Lucknow, even the principal secretary has clarified that there will be no action taken on the FIR. In fact, all action on the FIR which has been registered against the doctors there has been kept on abeyance. The doctors have actually really kind of returned to work, and they're also attending to patients there because they understand that the government has perhaps been blackmailed enough not to act against such erring doctors. Negligence on part of whom actually led to most of these 49 deaths. So clearly the government taking a step back and allowing the doctors to have their way as far as Farrukhabad district hospital is concerned.
If we speak about the latest death that we are reporting today, is this a case of medical negligence which took place during the doctors were on strike, or there is more to it? What more do we know about this particular death?
Well, it is not that easy to categorize deaths as having been caused by negligence or in regular course. This is something that will need to be found out after postmortem is conducted, if at all postmortem is actually conducted. And the government doctors finally go on to concede that this is a death which is caused by negligence. So, number of formalities required to take place before it can actually be, the latest death can actually be, it can be described as one caused by negligence. But yes, the very fact that many of the attendants to these patients, these young children out there who've actually died, have actually conceded before the camera that they have to pay money to get access to oxygen, which should ideally be supplied free of cost to all such poor patients, is proof enough that there are things on the ground there in the district hospital, the RML hospital in Farrukhabad, were actually not right. In fact, this has connotations of what had actually happened in the VRD Medical College in Gorakhpur, wherein the oxygen was not supplied because perhaps the payment to the supplying company was not made in time because the principal wanted some kind of a commission, some kind of a cut from the payment that is made to the oxygen supplying company. So similar kind of, circumstances emerging out here in Farrukhabad as well. But this is something that the government will actually need to find out in the high-level inquiry that has instituted yesterday. But the very fact that all action on the FIR that has been registered on the CMO and CMS has been kept on abeyance on the instructions of top babus out here in state capital Lucknow, it is absolutely clear that the blackmail that the doctor had started doing there in Farrukhabad is continuing with the government, and the government has actually taken a step back as far as taking action against errant doctors for death of kids is concerned.
All right, Amir, thanks for getting us those updates on that story.
जो 49 बच्चे नहीं मरे हैं, बच्चे टोटल हैं मल्ला एक्सपायर हुए 30, 461 डिलीवरी हुई थी, उसमें 400 बच्चे अक्सर पैदा हुए, कुछ बच्चे ट्विन पैदा हुए और उसमें 19 बच्चे स्टिल बर्थ हुए, मतलब पेट में मर गए और 66 बच्चे जो हैं भर्ती हुए थे, उसमें 6 बच्चे मतलब एक्सपायर हुए हैं और 143 डिलीवरी बाहर से आई हैं, उसमें 24 एक्सपायर हुए हैं।
24 बच्चे जो हैं विभिन्न प्राइवेट अस्पताल गंभीर अवस्था में रेफर किए गए थे, वो मरे और उसके अलावा जो हमारे अस्पताल में केवल 6 बच्चे जो हैं इनबॉर्न, मतलब जो लोहिया अस्पताल की डिलीवरीज है उसमें केवल 6 बच्चे मरे हैं। तो ये पूरे महीने की डेथ है, जो कि एक मृत्यु जो है एक दिन के एवरेज बैठती है और इसका आंकड़ा जो है 12% है टोटल डेथ्स का।
मीडिया के द्वारा जो प्रसारित किया जा रहा है वो हॉस्पिटल में ऑक्सीजन की सप्लाई की कमी की वजह से डेथ दिखाई जा रही है, ऐसा कुछ भी नहीं है।